Chanchal, can you see me?
Yes, ma'am, you're visible and audible. I'm Pranjali Joshi.
So should I share the first slide and be ready?
No, ma'am, we'll start with the introduction first and then I'll just get in touch.
Evening, ma'am. I'm very sorry that it has been delayed slightly.
Yeah, that's no problem.
There was a little technical error. Yeah. So, so right now we're live on YouTube. So we have sent the link to everyone.
Yeah.
So hopefully it's going to work out.
Yeah.
So what I'd like to do is I'll introduce you because it's only fair to begin introduction, right? You're so established in this field and we don't know anything about it. So today the time to actually come and educate us about it. It's a very big deal. So, hello everyone, and welcome to today's session. This is the third part of the week long series of Webodontia. These events are by the Rotaract Club of the Caduceus, is an organization of youth medical and paramedical students. Webodontia is a weekly event with educational webinars blended with fun activities. So before we begin, I'd like to mention that again that we're live on YouTube, so it's a recorded session and y'all can view it anytime. And we will be providing a feedback form for certificates after the event. So to introduce today's speaker, Sneha ma'am. She is an established sports dentist. She has done her BDS from MUHS itself in Maharashtra. She has an international certification in aesthetic dentistry and oral rehabilitation under the New York University College of Dentistry in USA. In sports science at the ISST, the thesis submission and importance of mouthguards in various sports. Cover that as well, which is basics of mouthguards. She has a diploma in clinical diet at IICTN. So she's going to also explain the importance of nutrition in sports dentistry and in general dentistry as well. And she has a certificate in youth fitness and senior fitness. In all, she's a very established speaker. And over to you, ma'am. You would like to begin.
Yeah, sure. Good evening, everyone. I'm Dr. Sneha Divekar and I'm a sports dentist from Pune. So I would like to first start sharing the content of my slide and then I'll begin. Okay. So just give me a minute. Can you see it?
Screen is visible.
Visible, right? Okay. So everyone is there on board?
Yes, ma'am. Everyone's viewing it on YouTube.
Okay. So I hope people have woken up from their Saturday afternoon sleep and fresh to listen to something new and interesting in dentistry. Yes. right? Yeah. Okay, so here I begin. Okay. So yes, I am a sports dentist, and I'm going to talk about sports dentistry and how is it still a nascent field in our country. So before I jump into the topic, I would like to tell something a little bit. Just a second. Yeah. I am the faculty at the Institute of Sports Science and Technology, conducting certificate in sports dentistry course, which is first of its kind of course for dentists in India. I have conducted many one-day workshops on sports dentistry. I have been a local dental speaker on sports dentistry, speaking at various IDA branches, local dental study clubs, and dental colleges. I have been a state speaker on sports dentistry, speaking in various interstate or state dental conferences. And I'm really proud to share that last year I have been a national dental speaker on sports dentistry at an exclusive sports dentistry symposium at the second National ISDT conference in Chennai in December. And I got the privilege to meet with many stalwarts on dental trauma and mouthguards and sports dentistry. So all these people, they are full of knowledge, and I was really blessed to share some good information with all of them. I have been conducting various dental care awareness programs for athletes and Dento-facial injury awareness programs at various sports clubs and schools in and around Pune. Okay, so now coming to the main topic, sports dentistry. Is it still a nascent field? Well, yes, it is a nascent field in India, but not so in other countries. I will come to that soon. So, what are the things that I'm going to talk about right now? Introduction to sports dentistry. What can be your role as a sports dentist? Are dental injuries in sports on the rise? Why is oral health of athlete important? What are mouth guards? What aspects of dental trauma management are important in sports? How to establish as a sports dentist, and how to learn sports dentistry. Sports dentistry is an old field of dentistry in countries like US, UK, Australia since last 3 decades. Yes, believe me, not 1 decade, not 2 decade, since last 3 decades. And people in India have not even forget about other people. Dentists in India, they have not heard about it. So it is quite natural that other people, you can't expect the layman to know anything about it. So now that we know that not enough people know about it, so what to do? There has to be some plan of action in place. So first thing that we need to do is to educate the dentist, which is what exactly we are doing here on this platform right now. Then the next step is to educate the athlete, the main patient, the athlete's parents, and all those who are around the athlete, the coach. Educate the sports administration, the coaches, the sports administrators, and a lot of people surrounding the athletes. Why is it important? 50% of kids participating in sports could experience a dental injury by graduation. 3 million teeth are lost at sporting events annually, and these are based on some studies. These are not just any random guessworks here. Okay. And the most important thing is dental injury is the most common type of oral and facial injury which is sustained during participation in sports. And the most important factor here is the majority of dental injuries are preventable. Also, athletes tend to have a erratic eating schedule. They tend to drink most kinds of sports drinks, and their diet is a little bit erratic. They have more carbs in their diet. They tend to have more usage of drugs and tobacco. So all these things can lead to various dental issues in them, right from simple dental caries, gum disease, stained teeth and gums, to advanced things like oral cancer, diminished sense of taste and smell, etc. So, what all does sports dentistry include? There are two main things: oral care of athlete and dentofacial injury prevention and management. Now, for simpler understanding of everyone, I have split the main topics like this: oral care of athlete, diet modification, tobacco or substance abuse counseling in athletes, customized or boil and bite mouth guard fabrication for the athletes, dental injury prevention programs, and the most important part, the emergency and long-term dental management, dental trauma management. Sports dentistry is the most recent and upcoming field in dentistry. It includes the prevention and management of athletic related orofacial injuries and associated oral diseases. There is increased scope of dentists in the sports medicine team. So this is a very important aspect in all this. Okay, so what is the definition? According to the International Academy of Sports Dentistry, sports dentistry is the branch of dentistry that involves prevention of oral sports injuries and treatment of dental athletic injuries. It also involves the collection and dissemination of information on dental athletic injuries and encourages research in the prevention of such injuries. So now you have got a fair idea of what sports dentistry is. Now let us have a look at what will be the role of the sports dentist, or as a dentist, what do you expect your role to be in the sports medicine team? So again here, for better understanding, I have divided the role as the main role and additional roles. So the main role of a sports dentist is oral care of athlete, customized mouth guard fabrication, modifications in the athlete diet, especially if the diet is causing a lot of dental decay and dental erosion, then definitely the diet needs to be modified. And most important, dentofacial injury management and prevention of dentofacial injury by creating awareness. Now, what are the additional roles? The most important is referral to the proper medical personnel. See, suppose an athlete gets injured, and if there is along with dental injury, there is slight concussion. By concussion, what we mean is, there is slight brain injury to the athlete, but the athlete is not able to understand what is happening. So there are a few signs and symptoms about concussion, like headache, dizziness, etc. So if the dentist gets to notice all this, first thing before starting any dental injury management, the patient has to be referred to any other medical personnel, because the concussion part needs to be taken care of first, and then the dental injury comes after that. Then recognition of doping. There are a lot of drugs involved in athletic competitions. There is a lot of doping issues, and one more reason why the dentist needs to know this is because if the athlete is having any dental problems like dental pain or dental infection, there are some drugs that the dentist prescribes in the usual prescription stuff, which can hamper or which are prohibited drug, mentioned in the prohibited drug list of the athlete. So you should not be prescribing such kind of drugs, especially if the athlete is very close to any major event or major competition. And then recognition of tobacco or substance abuse and counseling for that, health assessment of the athletes, because along with the general health, oral health, the sports dentist also needs to know what is the general health of the athlete. Recognition of eating disorders. This is very important because eating disorders, they have a very high chance of developing bruxism, dental erosion in the athlete's mouth. And special need athletes. See, those athletes who are physically or mentally incapable, they too have right to play. There are a lot of organizations who conduct sports activities for such kind of athletes. So it is also important to look after the oral care of such special need athletes. As a sports dentist, you must know, with which other health professionals would you be dealing with, which and for what reason. Like for example, the most commonly that the dentist will need to interact with on a regular basis will be the sports physician or the sports doctor, mainly for reasons like medication interactions, doping, infection spread, and if there is a previous history of traumatology of the athlete. Then very very important is interaction with the sports coach. You as a dentist, you approach any sports club, any school, college, the first person that you are going to interact with is the coach, and the coach has a very big influence on athletes decisions. So if the coach is saying that you must wear a mouth guard, then the athlete and the parents, they will listen to them more than the dentist. They believe the coach more. So it is very important to for education and prioritization of oral health of the athlete. You have to train the coach and the paramedic staff in that way. Then next is comes the psychologist. If you see that if the athlete is having bruxism, lot of occlusion issues, stress, there can be the reasons can be eating disorders, and it can lead to dental erosion. So in these cases, you have to consult the psychologist as well. Buccal respiration, which means through the mouth, like mouth. A lot of athletes have a habit of mouth breathing, so you have to contact the physiotherapist. Then posture and articulations and osteopath. Then for dental, this is another very important again. For dental, severe dental caries and dental erosion, it is very important for you yourself to have knowledge about sports nutrition. Plus, along with that, for any kind of severe cases, you have to get in touch with the sports nutritionist, and together you have to devise a plan which will modify the athlete's diet so that the health is also maintained and the dental oral health is also maintained. Okay. And another thing which is not very common in India, a podiatrist. These people for correct occlusion, correct posture, correct distribution of corporal forces. Now, this part, it is mostly the dentist in India, they will have to refer to either the sports physician or the orthopedic doctor. The sports dentist should have knowledge about which different topics. Now, this is very interesting. And also, again, for a simpler understanding of this, I have divided the topics into sports related topics and dental related topics. Now, the sports related topics are sports physiology, sports medicine, sports nutrition, basic sports first aid, doping, protective equipment for head, face, neck, tobacco or drug abuse, counseling in athletes, and sports psychology. Now, the dental related topics are prevalence of dento-facial injuries in sports, oral care of athlete, dento-facial injury prevention programs, mouthguards is a very, very big topic, emergency and long-term management of dento-facial injuries. Again, this is a very crucial and a very important topic, and dental treatment of tobacco or drug abusing athletes. So, of course, every dentist at the end of the day will have this question in their minds, like as to why, what benefit will I have, or what benefit does the dentist have. So, additional athlete clients and related people come to the dental clinic. If you have your practice right now, well and good. Even if you don't have, you can think think in future that tomorrow if I establish my own clinic, these are all the benefits that I can have if I pursue this career. Revenue generation through mouthguard fabrication and general dental treatments, and very important thing, opportunity to associate with various schools, colleges, and sports club as a consultant sports dentist. See, some people have asked me that what job opportunities do we have. So right now in India, as for now, there are no direct sports dentist or team dentist job openings anywhere. But yes, along with your routine clinical practice, or suppose if you are working with some senior dentist, okay, so you can do this. You just like we have a consultant pediatric dentist or a consulting orthodontist, you can be like a consultant sports dentist to other dental clinics. Who have other dentists who don't have information about mouthguards and stuff, and a consultant dentist to all the schools, colleges, and sports clubs in your vicinity. And also, definitely, being a sports dentist, it will be a good marketing for yourself and for your clinic. Because see, in today's digital world, it is very important to stand out, be different, do something different. So people notice you, patients notice you, And you know what? Why I like personally this sports dentistry, because even if you grow older, you are always in touch with younger generation through this sports dental care, because you get to know many athletes, their problems. So it is always very interesting that a 14-year-old boy also can teach you so many things, by his reactions when kids fall on their face. Today's kids, they are so they are so what do you say, conscious. We were never like this ever in our lifetime. In those days, when at the age of 13 or 14, today they are so conscious. Even if they have an at least class 1 or 2 fracture, they refuse to go to the school. They are very conscious. They don't I mean, I have seen such patients, they refuse to go to school. They said that, till the time I don't get my tooth treated, I'm not going anywhere. So that kind of consciousness today's kids have. So for such kind of patients, it is very interesting to interact with them. And of course, revenue generation. See, it's very interesting to do, and it's very satisfying to do a class 1 and such kind of composite restorations, because they are very simple, they are easy to do. But yes, if there are complex fractures, then definitely you need to have a bigger team. I'll come to that, because being a sports dentist is, it's not a single person's job. There can be a lot of complications as well, and you need a bigger team in that. So yes, let us look at some statistics. Are the dentofacial injuries increasing in sports? Yes, but why are they increasing? See, 20, 30 years back, in countries like US, UK, they started having a lot of aggressive sports in their country, a lot of contact sports, and that is the main reason why sports dentistry developed earlier in those countries. Now in India, if we go to see, in last 10 to 15 years, you can see a drastic difference. You will see there are so many sports clubs, sports academies mushroomed all over the all towns and cities of India. So yes, if the athletes are exposed to a lot of contact sports, then definitely the overall rate of injury is going to increase, and in the end, as I said before, dentofacial injuries are going to increase. So it is estimated that over 5 million teeth are damaged or lost each year in sports. This is a very, very big number, believe me. An athlete has a 33% chance of sustaining a dental injury in sports, and 80% of the tooth injuries are to the maxillary central incisors. So you can imagine how aesthetically this point becomes very important. Yes. So, as I said before, dental injuries are the most commonly sustained orofacial injuries during participation in sports, especially contact sports. Now, what are contact sports? They are those sports in which players physically interact with each other, trying to prevent the opposing team or person from winning. What can be the incidence? As less as 2% to as high as 33%. Which are the sports in which there is a high chance of injury? Football, ice hockey, soccer, baseball, bicycling, gymnastics, basketball, alpine skiing, softball, karate, mountain biking. There is a huge list. Okay. What are the causes of dentofacial injuries? Here is a summary of some studies, and there are the factors have been divided into two: the game-related factors and the athlete-related factors. Now, getting hit on the face, collision with the opposing team, falling on the face, and teeth entanglement in the net. These are all game-related factors. The athlete-related factors, which can make the athlete vulnerable to injury, are muscle imbalance, fatigue, history of previous injury, dehydration, lack of nutrition, and dental pain or structural issues. So if the athlete is having any kind of dental pain, or if there are any structural abnormalities, the athlete is not having enough concentration while playing the game, and this fact itself can lead the athlete to falls or injuries. So again, I'm stressing on the same point again, that dental trauma in sports differs from other dental trauma. See, if you're crossing the road, if you're going on a two wheeler and you fall down, you can't help it. You don't know that that incident is going to happen with you. But when the athlete is playing, during training or playing during any event or competition, the athlete knows that there is a high chance that I might fall on my face. So the athlete or the coach knows that this can happen, and it is possible to easily prevent it. And there is also a possibility to dramatically reduce the occurrence levels by the use of mouth guards that protect all dental and periodontal structures. Basically, custom mouth guards are the best defense against any sports related dental injury. So you can see here there is a small case of dentoalveolar fracture in this case, which could have been very easily prevented with the use of a mouth guard. So right now the need of the hour is increase the demand of sports dentists and reduce dentofacial injuries. How do we do that? Create positions of sports dentist or team dentist in schools, colleges, sports clubs, just like any sports physician or nutritionist. Make protective equipment available, including mouth guards and headgears or face masks. And very important, attach sports rehabilitation centers and sports dentistry clinic. So if you want your clinic to be a sports dentistry clinic, and if you want more athletes to come to your clinic, it is best to attach yourself with a sports rehabilitation center so that you can serve the athletes better. Now, as you can see in the slide, the team dentist is at the center of the whole sports dental care cycle, and the athlete, the parent, the coach, and the sports club. So all of these together, as a team, they are responsible for taking the dental care of the athlete. This is from point of view of the athlete and the sports club, etc. Now there is a team in the dental clinic as well, which is responsible for the dental care of the athlete. We'll come to that later. So yes, now what are the three most important things that the dentist or the sports dentist should know? General dental care and nutrition of the athlete, type of mouth guards and the sports, and dentofacial emergency management and long-term management as well. General dental care. What does the athlete's diet have in high proportion more than the normal population? Fruit drinks, sports drinks, soft drinks, wine, beer, celebrations, match jeet gaye, chalo celebrate karo. So, in various kinds of forms, more percentage of carbohydrate consumption. So, because of this, there is a high rate of dental decay and erosion seen in athletes. There are some facts about sports drinks. Now, this is of course a US study, but the same things have started to happen in India. 62% of teens drink sports drinks at least once every day. Sports drinks make up 10 to 15% of their daily caloric intake, and for athletes, this is even slightly higher, I would like to say. So, why good oral hygiene is essential for athletes? Why are we stressing so much that they should take care, they should take care? Because an athlete is often always concerned about his training schedules, staying hydrated and meeting nutritional goals. But during all these processes, oral health is often looked, which may not affect the sports performance but will compromise oral health in the long run. So these vigorous trainings leave the athlete craving for high calorie intake, for which they often turn to energy drinks and workout supplements, and all types of sticky carbs, which we usually don't recommend for any child or any person to eat. They tend to consume this on a very frequent high frequency. Okay. And yes, they have mentioned that the sports performance may not be affected, but there is also a chance that the sports performance may be affected if any athlete is having a very serious kind of dental problems. Then yes, definitely the sports performance is going to get affected. And see, we all know today that oral health is deeply connected to the general health. So if the oral health is good, it is always going to be a plus point for the athlete, and his performance is going to be better. So does the athlete often neglect his or oral health? Yes. How to improve the oral health so that it improves the overall health and helps improve the athlete's performance? Dental education of athlete is very important. Regarding the athlete has to be made aware regarding what all various dental problems he or she can face during sports. We have to give correct guidance about the diet, teach them proper oral hygiene techniques, and basically tell them why oral health is very important part of their life. So now we move on to mouth guards. So before we jump on to what are the types and all that stuff, Let us know what are the different world dental associations recommending. This is not just a something very small thing. Are tu mouthguard pehan le? No. This is a proper systematic recommendation, all done by all world dental associations all over the world, which even we have to follow in the same manner. So the American Dental Association has continued to promote the use of mouthguards right from 1940s, and even in 1970s, they made mouthguards mandatory in college football. Then currently, as of today, the ADA recommends mouthguards to be used in 29 sports. So 29 sports is not less. It's a huge number. Okay, so just leave 29 sports aside. In India, even if we focus on basic 10 sports which require mouthguards, we will save a lot of teeth. All contact sports, and don't be under the impression that cycling or skating, they are non-contact sports, they don't require mouthguards. No, I would say I have had patients coming to me because they have fallen while doing cycling, they have fallen while skating. So even these sports equally, they are recommended mouthguards for those athletes. The Australian Dental Association has identified 20 sports played by Aussie kids in which mouthguards should be worn. So, they have this kind of logo. When it's game on, it's mouthguard in. Okay. So, what is a sports mouthguard? A sports mouthguard is a protective device for the mouth that covers the teeth and gums to prevent and reduce injury to the teeth, arches, lips, and gums. Now, there are three main types of mouthguards. The first is the over-the-counter, or what we usually call as stock mouthguard. It is made of rubber or polyvinyl, and it is sold in small, medium, or large sizes. You will get it at any sports goods store. You will find these mouthguards. The next one is the boil and bite mouthguard. We have to boil it in water, and it is formed to the athlete's teeth. The next is the custom-made mouthguard. It is made in the dental clinic by taking a full mouth impression. I'll be talking about this in detail. But first, before we discuss in detail the types of mouthguards, we must know why. Why do you need a mouthguard? Why? What happens? How does the mouthguard help to protect the athlete? Mouthguards are designed to absorb and distribute the forces of impact received while participating in athletic activities. Like, for example, in a mouth impact, it causes possible damage to the soft tissues of the lips, cheeks, tongue, and gums, as well as the teeth and upper jaw. Then, if there is a direct jaw impact or under the chin impact, it can cause possible damage to the teeth, TMJ, and jaws. So, now what does the mouthguard do? A properly fitted mouthguard reduces the force upon impact, helping to protect the jaws from fracture. Now, in case of jaw joint, the properly fitted mouthguard reduces the potential for jaw joint fracture and displacement by cushioning against the impact. And of course, lacerations. It helps to protect the soft tissues of the lips, cheeks, gums, and tongue by covering the sharp surfaces. You know why the lips and the soft tissues in this perioral region, why do they get affected? Many times not because of getting hit, but the most common reason is when the athlete gets hit. Oh, this is what happens. The lips portion, it gets sunken in either the upper teeth or the lower teeth, and believe me, the teeth are very, very sharp. They are designed to cut food, so the lips get injured mainly because of the teeth impingement. Okay, so for that reason, if the mouth guard is in place, then this issue doesn't arise. Now let us see a comparison of mouth guards. So what do you think are the best type of mouth guards? First, let us see the stock mouth guards. It has no individual fitting. It is least desirable. It is available at local sports stores for 200-300 rupees, and we see a lot of athletes using that. Boil and bite mouth guards, their individual fitting is attempted by boiling the material and adapting to individual teeth. It has a little better fit, but still it is less desirable. it is maximum used by all the athletes that I have seen till date. But what the problem with this is, there is uneven distribution of material does not allow proper fit and protection. So I would say that, psychologically the athlete is feeling, okay, my teeth are protected, but actually it is not happening. Actually, when the patient falls on the mouth, there is no guarantee that this type of mouth guard will protect the athlete's oral structures and teeth. So, which is the most preferred type? Custom fabricated mouth guard. It is fabricated under proper guidance of the dentist. They are either made in the dental clinic or sent by the dentist to the lab for custom fabrication with proper guidelines. The advantage of a custom made mouth guard is its fit, adaptability to individual speech requirements, customized occlusion, and no interference in breathing. So, what are the steps and dental visits for customized mouth guard? The athlete visits the dental clinic. The dentist checks the oral cavity, takes a proper history, recommends the correct type of mouth guard. Then the impression of the mouth is taken. It is sent to the lab for the fabrication, and in the last step, the mouth guard comes back to the dental clinic and is adjusted and delivered to the athlete. What now after mouth guards, the third important point is what aspects of dental trauma management are important in sports. The first and the foremost thing that the dentist must have is the first aid kit in the clinic, kind of a ready to go bag, ready to take bag with him or her. It should have dental supplies. If the dentist or if the paramedical staff is not able to replant the Evel's tooth soon, the intact tooth or the remnants should be kept in a storage media. So, Hank's balanced salt solution. Now, this thing the dentist also must carry, definitely, one important point. Second important point, the dentist should train the paramedic staff that even they need to have all these supplies with them. See, because the thing is, it is really not possible for the dentist to be present on the field every time there is a play or every time there is an event. So, all this kit that I am explaining, it has to be there with the dentist as well, and as well with the paramedic staff or with the coach, so that if there is any emergency situation, then they have these storage media like Hank's balanced salt solution, cold milk. The tooth can be kept inside the patient's cheek, and saline. One more thing I would like to add here. I will erase this water later on because water is a big no-no. The tooth cannot be kept in water. Water is a big no. Either best thing is HBSS and cold milk. And if nothing is available, patient's saliva is the best. And other supplies are eye medications, dressing, topical skin preparations, prescriptions, general medications, etc. Now, how to go about the dental injury management, or what prevention we can do to avoid the happening of the dental injury in the first place? Dental checkups, just like the athlete is having any kind of physical examination before the event, the athlete has to undergo dental examination. What kind of athlete patients are at increased risk of dental trauma? Those playing contact sports, increased overcheck, having anterior restorations, high smile line, athletes having braces, and younger athletes having mixed dentition or immature teeth. Which other sports with high risk of mouth injury? Basketball, football, baseball, soccer, boxing, martial arts, and gymnastics. So these are the 6 main. And as I showed you before, there are many others as well. There's a big list, but these 6 to 7 are the main ones, priority wise. So dental and sports history helps decide risk factor for the dental injury. What are the dental care recommendations for dental injury prevention? Preventive dental checkup before the game season, dental treatments for athletes with high risk, custom mouthguard fabrications, and again here important thing that you have to remember regarding the mouthguard is you have to ask the athlete to wear it during the regular practice as well. It is not possible that the athlete comes 4 days before the actual event and tells that I want a mouthguard, because what happens is the athlete is not comfortable while playing using that mouthguard. So they have to have, if need be, they can be given two sets of mouth guards, one for during the play and one during the event. But the main thing is that they have to be comfortable. They have to practice using those mouth guards. Right? Education on oral hygiene and importance of oral health in athletes. Okay. The dentist should teach the paramedic staff to look out for these signs of dental injury on the field. See, for example, either the tooth is pushed. See, you have to explain this in a simpler language to them. Okay, the tooth is either pushed forward or backward. There is bleeding along the gum line. There are obvious defects, like if the tooth is chipped, a fracture can occur above or below the gum line. It is painful. The fracture will result in loosening of the adjacent teeth, bleeding gums, numbness, inability to open or close the mouth, and missing tooth. This is a very, very important sign. If the tooth is missing with bleeding from the exposed socket, and very poor prognosis if more than 2 hours elapse. Okay, so all these things you have to explain it to the paramedic staff, to the coaches, the parents, the athlete. They have to know, and it is your duty. You are the sports dentist, so you have to explain them all these things. And most important part is, see, when an athlete falls on the field, it's not necessary that he's going to have only dental injury or only bodily injury. Okay, both, there can be a combination of both. But in this case, what has to be done is, one most important factor that you have to see here is, if ABC or airway blood circulation is 0 or not normal, then first focus on the CPR. If there are any other major injuries, first you have to call EMS. Then emergency treatment of those injuries happens first, and only once the patient is stable, only then we can proceed for emergency dental care. Yeah, and yes, of course, if there are if the athlete is not suffering from any other injuries, if only there is severe dental injury, then you should not waste a single minute. Immediately the athlete has to be taken to the dental clinic. So let's just summarize what the sports dentist should know about dental injury management, dental and sporting history, assessing risk factors and dental trauma prevention, classification of dental trauma, and emergency and long-term management. So, okay, so now you have got some fair idea about what is sports dentistry, oral care, mouth guards, and dental management. Now, how do you establish yourself? So, if you have your own clinic or you plan to, you have to have your separate visiting card and a visiting card which is separate as a sports dentist. You cannot mix the two things. So, because you need to give this card to various athletes, patients, coaches, schools, sports clubs, etc. So they have to have a very clear picture in their mind that what is your role as a sports dentist. You have to form a sports dentistry center. Your clinic has to be a sports dentistry center. You have to form a team with dental and medical personnel. Mention your team details in your reception area. See, by medical personnel, I mean right from a physiotherapist, nutritionist, sports physician, you have to form a team. They should be available to you on call basis, and of course the regular team members can be, the most three important members are the oral surgeon, the orthodontist, and the pediatric dentist. These three are the main should be the main people in your team. Then get all basic emergency equipment in your clinic. Prepare an exclusive sports dental first aid kit. And please, you have to run a trial and practice with your team for emergencies. It just cannot happen that, one fine day you have been called and then you're running around everywhere. You don't know what to do. So you have to run a trial before before you approach the athletes for any kind of emergency situations. You have to distribute pamphlets to schools, sports clubs, etc., where you have to tell them what your qualifications are, what your services are as a sports dentist. You have to conduct dental care and dental facial injury awareness programs with schools, colleges, sports clubs, etc. You have to provide them take-home information to the athletes, because, listening to the lecture, I have seen people tend to forget everything. You have to give them some take-home information, like what are the types of mouth guards, why they are important, how to save your tooth in case of any emergencies, etc. And very important, you in today's digital world, in today's digital marketing world, you have to document your cases, what all treatments you have done, or what kind of camps you have conducted, where you have conducted those camps, who had responded how. So all these things you need to document. So now coming to the last part of my presentation, Sports dentistry, yes, it is definitely one step towards the future. Let us all be a part of the sports medicine team. You know why this slide is my favorite one? Because if you notice this image, the players on the sports medicine team, if you notice carefully, and below the physician, the dentist's name is mentioned. So now you as a dentist, do you realize that how important you are? Where do you rank? Where do you rank in the hierarchy? What kind of doctors are important in the sports medicine team? There you are ranking the second. That you yourself as a dentist, you don't know how important you are. So it is your duty. You must understand more about sports dentistry, learn more about it, and pass the message to as many people as you can around you, and make athletes and coaches aware about this. So, are you interested? Do you want to become a certified sports dentist? We have launched along with ISST a certificate in sports dentistry course. Now, this is a 3 months distance learning course with a 1 day contact workshop for practicing dentists. By practicing dentists, I mean that the eligibility of this course is once you complete your final year. Okay, so because see for sports dentistry, now you I have shown you the presentation. You must have got idea that till the time you don't complete your final year, you are not going to understand all the aspects of sports dentistry, because there are a lot of things that are involved, and you have to know all the final year subjects for that. Okay, so the eligibility criteria for this is internship and above. Okay, if you are an intern, or if you are a BDS, MDS, anyone above from intern and above that is eligible for this course. So this is our pamphlet of certificate in sports dentistry. I will just highlight what are the main points of our course. Basically, it is very convenient for dentists because it is a 3 months distance learning course. There is a online exam. Then see, because anything in dentistry, if you don't have any contact face-to-face workshop, you are not going to understand the all the various clinical aspects of it. So we have a 1 day practical orientation workshop in ISST in Pune. Then study notes are given to you, video lectures in the form of DVD or pen drive or access now. In the current scenario, I think we are providing the latest changes. We are providing password and login ID, and probably people get to see through that. And solving of queries through emails by the course faculty. I am the course faculty for this course. So what we do is we also form a WhatsApp group for those people who have taken admission for our course, because people then find it easier to solve their queries. What are the benefits for the dentist? The course helps the dentist with practical application immediately. We have asked the dentists to do a small practical assignment as well, so that the dentist should be able to immediately start using whatever the knowledge that they have gained through this course. The certificate is given by an institute. It's a National Sports Institute, and accreditation is received by the International Sports Professional Association, Chicago, USA. The dentist receives a recommendation letter from ISST, which helps the dentist to associate with various schools, colleges, sports clubs, or academies, etc. So, to conclude, what are the 3 important goals of a sports dentist? Fabrication of custom-made mouthguards and boil and bite mouthguards like Opro mouthguards. Now, Opro mouthguards again are one of the latest ones that are available in India. Again, I have taken the dealership of that. So, anyone who wants to know about all these things, they can contact me. Then prepare the athletes and coaches for dental emergencies. Do any kind of dental emergency treatments that might be required, and dental care of athlete and motivation for good oral care. It is always said that prevention is better than cure. In the same way, sports dentistry is better than avoidable dento-facial rehabilitation of the athlete. So let us look forward into the future. Let's bring sports dentistry to India. Let's make athletes, parents, coaches aware. Let's tell them, don't get kicked in the teeth. At least wear a mouth guard. So I thank you everyone from the team of Webodonsha, the team of Rotract Club, for giving me this opportunity to speak on this online platform. And I'm glad that everyone has made it on a nice Saturday evening to listen to all this new concepts or new topic in dentistry. So if anyone would like to know more details, you can take a screenshot of this or you can take a photo of this. These are my contact details. This is my Facebook page, Sports Dent Care Pune, and this is the website of isst.co.in where you'll get to know the details about our course. Thank you so much. Over to you, Chanchal.
Hi, ma'am. It was actually a very insightful lecture, I'd say, because it wasn't like, I mean, obviously it has much more, but it felt like, you actually get knowledge about things.
Yeah,
So it was very informative.
yeah,
In the YouTube chat box, I've got a few questions. I'll just ask you that.
yeah.
So someone asked that what is the eligibility criteria, which you already said that you have to be above
See,
final
we will
year.
need, see, if you're a final year pass out, we will need that mark sheet that your final year is over. Because that is, see, because all the subjects in the final year, all those are necessary to do the dental. See, because dental trauma management is not easy. To do the dental trauma management, you have to know all the subjects of dentistry. Okay. So, a final year mark sheet from your college is good enough.
Okay.
Yeah.
The next question is, can you please tell us other colleges offering sports dentistry?
See, there are no colleges offering beer sports dentistry. That is, the whole thing. If you saw my slide earlier, the thing is, we have started the first of its kind of course for dentists in India. There is no course in sports dentistry in India. So that is why there is no college giving this course. So once you complete your final year, you can get in touch with us and then you can do this course through distance learning and one day contact workshop. That is right now the only way to do it.
Okay. Okay. The next question is, would it be better to take sports dentistry training in India or abroad?
See, I'll tell you, it's one very simple thing right now. See, form goals of yourself first. See, if you are planning to settle, where you are planning to settle, what you want to do, there are a lot of things which depend on. See, this course is having all kinds of things which you need to know as a sports dentist. Okay, so once you do this course, you can go out, approach people, start, and basically another thing that I said was on your degree, like on your on the certificate that they give, there will be the logo of the ISPA USA International Accreditation will be there. So people who are reading it, see, I'll tell you what, the knowledge is more important. Hmm. See, you will spend a lot of money going out doing the course. It's not easy. So my advice to any young person would be, first you do this course, form a proper base for yourself, start doing patients because advanced courses that are there available outside, they are not easy. And if you don't know anything about this subject, it becomes really difficult. You are spending so much amount of money. So this course, it has been designed for any dentist just passed out, right from a simple intern to an advanced person. Everyone will understand the course content. Okay, so I would advise, first you do this basic course, then you start doing patients, start doing those kind of patients. And then if you feel that, see, right now you are young, you don't realize the importance of ROI. What is ROI? Return on investment. So if you invest a small amount right now in this course and then you start doing patients, and once you recover that amount, and then if you feel that, okay, and now I need to upgrade more, or I need to go to an advanced version, then you go ahead. There is no issue. ओके, जो यहाँ पे अभी इजीली मिल रहा है वो छोड़ के दूसरे चीज के पीछे भागना राइट नाउ डजंट मेक सेंस, because right now our country is just budding for sports industry. It is opening avenues. Okay, so it's not yet full-fledged established like cosmetic dentistry. Okay, so you have to take all those factors into account as well. Okay.
So you're saying that doing a course here would be better for starting practice here right now.
Yeah. Definitely, no doubt about that.
Okay, ma'am. And the last question would be, can you brief a little bit again about the certificate course details after final year?
After final year,
Yeah, it's a question that after final year, the certificate course, uska detail.
should I think I'll just go to the previous slide if you want me to.
Yeah.
See, if you see in this, there it is mentioned that the course is ideal for dental interns, BDS graduates, postgraduates, clinicians, academicians, everyone. Okay. So once you complete your final year, you are eligible to do this course. Okay. And as I said again, I'll come to the course highlights. It is a 3 months distance learning program, which means that once you contact our institute, the Institute of Sports Science and Technology, I will see what I will do, Chanchal. I will share the link for the course to your WhatsApp, and then you can circulate it to all your friends. Okay, so that by opening that link, you will get to see the entire page of the course. What all details are there about the course? Okay, so it is a online exam, which is a small 100 marks online exam, because see, it's a 250-page book that you have to study. Because see, as I explained earlier, there are just topics, sports related topics and dental related topics that you need to know. So sitting here, we don't know how much you have learned. So there has to be some uniform assessment of everyone, because right now we are having participants all over India. So we are having participants from Delhi, we are having participants from Bangalore, Mumbai, even Pune also. But all over the country, people are interested in doing this course. So sitting here, we need to evaluate whether have you really gone through the study material or no. So for that purpose, we send you a question paper, okay, and within a span of 1 month, you have to submit back us the answers. It is an open book exam. No need to, it's not like a college exam, or these kind of exams are different. They are not like college, you have to go and you have to write answers. No, these are open end exams. We help you to solve any of your queries while you are going through the study material. We provide you with video lectures as well. And of course, why the deliberately we have kept the contact workshop, because you come face to face with me as I am the faculty, and then we talk about all the important aspects. See, because what happens is, in sports dentistry, there are few topics not significant but still important, and few topics which are very, very important. Okay, so what we tell the candidates to do, the not so important topics, we send the video lectures for all those topics. Okay, so that you go through the video lectures and you read. And the important topics like mouthguard fabric, dental trauma management, how to do the oral care of the athlete, all those topics we expect you to read the book and then come for the workshop, so that there is a one-on-one discussion. There are slides presentations. We talk about the whole thing in detail. We give you a, what do you say? We give you a proper clinical orientation, that tomorrow when you go to the clinic and when you get a patient, how to go about doing it. Okay.
Got it. Got it. So to end it, I would just like to say that we are all, I'm sure, like we're all inspired to take up the path that you have, because it's something new for us. The whole
Yeah,
concept.
definitely.
And although you said that it started in the 1960s and 70s,
Yeah. I mean, even I was surprised when I came to know about it the first time.
yeah. So I think it's remarkable how you're ready to help today and tell us to take up this path.
My pleasure.
Thank you. Thank you,
Yeah.
ma'am.
Most welcome.
Also, yes, thank you everyone who is here today for attending this lecture.
Yeah.
And I a feedback form. Please do fill that. And thank you, ma'am.
Yeah, yeah. It's my pleasure to be amongst all of you. So if you have, I'll send you the link and you can share it. And if you have any queries, you can
Yes,
contact me.
ma'am.
Okay, you can give my contact details. Okay.
Yes. Thank you.
Okay.
I'm
Bye.
excited. Yes.
Have a good weekend.
You too, ma'am.
Yeah. Okay. So I'll just log out.